We have Therese Johnson of Senior Care of Sacramento. Therese, how are you?
Hi, Jim. I'm doing good, and looks like you're doing pretty good with your health and fitness goals. I see you've met some of your goals already this year.
Yeah, I'm trying, and one of the things that's really exciting, I realized I couldn't do it alone. I want to thank Cammie here, because I do call her, hey, what do you think of this? Just whenever I go out, it's kind of neat to be able to read and have it on my mind, and it really is about being mindful of what I eat. Isn't that right, Cammie?
That's right, Jim.
And I think about, now I know you work with a lot of seniors. And, as we go ahead and get older, our needs are a little bit different. And I just want to ask, just jump right into it, Therese. I know you work with placement with a lot of people that are aging and also their children as well. Do you have any recommendations for health and fitness for the senior audience? What is your thoughts on that?
Well, yes, and I'd like to address actually the caregivers that are caring for the seniors, because this is everyone's making their plans for health and fitness and their goals for the new year, and there's a care out there that they might not be aware of that would help them with their New Year's fitness goals, and that's Respite Care. A lot of people haven't heard of that, and it's a really good option. Since 95% of our caregivers are daughters and daughters-in-laws, they're the ones taking care of the seniors. It's important for them to maintain their health and well-being and their fitness too. And so I want them to be aware that there's short-term care options available to them. Because I always advise them to take a vacation at least every 4 to 6 months, have some time off, even if it's only a weekend or a week, or even if you can only squeeze in a day here and there. Respite Care can be the answer to that. And Respite Care is provided by several different resources. You can have in-home caregivers come into your home, or you can place someone at an assisted living for a week or two so you can go on vacation, or even up to a month, maybe 2 months is considered Respite Care. Also, there's daycare where they can go like once a week just for the day. There are some daycare services also that can give you some time off.
When we go ahead and talk about, caring for the caregiver, I know Healings in Motion has a program. That's the organization we talk a lot about here. Just really caregivers taking care of themselves and helping my father, and I know Cammie helping her family as well, her mom. It takes a lot out of you. And for those that don't know what it is, can you just briefly describe what Respite Care is? What is Respite Care?
So it's basically short-term care, and it's done by large facilities, small facilities, and in-home care services also provide temporary, like a one-time thing, like if you want to go on vacation for 2 weeks. And we help people get set up with whatever option is going to be best for them. And it costs a little bit more usually than permanent, like a permanent placement. It's about $125 to $175 on average per day for respite care, depending on if they're going to a large place or a small place, and it's a little bit different if it's for in-home care. In-home care is a little more expensive, and then there's the daycare programs where you actually take person either to some place where they care for them and they can spend the night, or they can just do a daytime service, or someone can come to your home. The daycare programs, they're far and few between, but we do help people find those, and some can be a little more cost effective because a lot of them are based on a sliding scale based on your income. So those are another option for people.
So basically, respite care gives caregivers a relief. Is that correct? So that they can basically get refreshed.
Right. Gives them some relief and a day off.
That's always a good thing. Now, are there any advantages to using just respite care services? What are the advantages?
Yes. There are some other advantages to respite care besides having a day off and taking a vacation. They can be used for like pre-planning and preparing someone for a future placement. Like say, that maybe down the road your loved one's going to need permanent placement because in-home care is not going to work for them at some point. And so by setting up a temporary or a short-term placement for a weekend or a week or a month to give, not only what is it giving you, the caregiver, a rest and a break, but it's also allowing for your loved one to get familiar with maybe another option or a place that they may need to move to in the future, and they can start getting over maybe some of their fears about that transition or about moving, because they know they're not going there right now. It's just a temporary situation for you to have a vacation, and you can start start planting the seeds in your loved one and make it, and help alleviating that fear for them. And also, if an emergency comes up with a family member, they've already been there once for maybe a week or so. So say you needed to move them quickly for some reason because you had to go help another family member, they've already been there. It's going to be an easier thing to have them go for that another temporary emergency situation. For example, I was taking care of my mom who has dementia, and my son had been in the Army and he got discharged. Finally, he was out. I hadn't seen him in a year, and for my own peace of mind, I needed to go see my son when he got back from Iraq, and but he was out of state, so I had fortunately had my mom stay at a local small residential care place for a week so she would be comfortable with it. So when he got home, she wasn't afraid to go there, so I could go have some time to spend with my son for my own peace of mind so that I could see him and for my well-being.
That's great. And finally, we just have a couple minutes left here. What impact does caregiving have on a caregiver's health? You know, and a caregiver could be a parent. We're specifically talking, could be a parent or even a teacher to some degree, but we're talking about a caregiver for a senior. What impact can it have when the senior has real need? How does that impact the caregiver?
Well, you know, Jim, research shows that an estimated 17 to 35% of family caregivers view their health as fair to poor, and 11% of family caregivers report that caregiving has caused their physical health to deteriorate. That's why it's so important for them to take care of themselves. And also, caregivers, regardless of their employment status, report that their positive activities in their daily life are reduced by 27% as a result of caregiving responsibilities, and the effect on their personal life is 3 times more than the effect on employment.
Wow. Well, thanks for joining us. That's Therese Johnson of Senior Care of Sacramento. You can reach them at seniorcareofsacramento.com. And so we want to thank you so much for the value that you give to our audience. And of course, in our senior years, you want to have a plan ahead of time. Absolutely, it impacts your personal financial situation. If somebody you love, perhaps your parent, is going through this could really devastate families. So make sure you consider what your alternatives are ahead of time. And for this today, just if you have a caregiver, treat them with respect, love them, thank them. But also, it's so important for caregivers to be refreshed. And thank you so much for talking about Respite Care.